everybody, and welcome back. This is just going to be a very brief coverage on topics regarding disorders of the brain and the central nervous system. There's not a ton of content to cover here, but the content that is here is important because as first responders, you most definitely will be engaging with people who fall under these categories. So the first is going to be delirium, and first responders of all kinds are going to come into contact with people experiencing delirium. And delirium is characterized by being in a state of confusion, disorientation, and an inability to focus. When somebody is under delirium, they can't remember things, their language can be impaired, they can have a hard time communicating what's going on or what's recently happened. And the onset of delirium is very, very rapid. It can be caused by any number of things from drugs to head injury to high fevers to poisons that seep into the brain. But it's not uncommon for first responders to come across this. So I want you to be aware of it so you can recognize it when it happens, that it's not somebody being difficult or somebody being drunk or whatever. The next one is also very common, which is going to be dementia. And certainly as our baby boomers move into their senior years, this is ever more present in our society, and first responders are going to have a bigger role in managing this population. This is another brain dysfunction, and it is a decline in brain function that impairs memory, language, and overall cognitive functioning. It's literally, it has a lot of causes, right? I mean, it's caused by Alzheimer's disease, Parkinson's disease. It can happen as a result of head injury, Huntington's disease, very advanced HIV infections. There's a lot of causes for dementia and just simply old age, right? A lot of people fall into the dementia category as they age. Very important for you to be aware of this because certainly early on in the dementia, people aren't quite sure that they have dementia or their family members haven't quite identified it or recognized it yet. So they're still living independently. It's not at all uncommon for people with dementia to get lost, to forget where they're going, why they were there, to forget how to get home, and that this is certainly something that's going to come across your path as a first responder. Less likely, but also possible, are amnesic disorders. So we've talked about this a little bit, that amnesia is simply, amnesic is the inability to recall or record information that you just learned. That literally, that information is not staying in your long-term memory. It decays from your short-term memory and it's just gone, right? It's just gone. And maybe there are amnesic disorders that are related to dementia. They could be hand in hand. Severe head injuries have demonstrated amnesic disorders, but also severe alcoholism. Really severe alcoholism. And remember, the homeless population tends to have an extremely high rate of substance abuse, alcoholism being at the top of that list, and therefore you may encounter amnesic disorders with the homeless population that you encounter when you work. I'm going to throw this out there just because it's important to understand, because it can be very frustrating if you don't understand what it is, and you have to deal with somebody who has this. And those are attentional disorders, ADD or ADHD, and we're going to talk about this a little bit more when we talk about childhood disorders. But if you don't know somebody has this, communicating with them and engaging with them can be very frustrating. You can see them as very defiant, very difficult, rather than somebody who has a disorder, right? They're very impulsive. They have a really hard time focusing, a really hard time concentrating. So engaging in a dialogue with them can be a very big challenge. They can be very hyperactive. They can be very restless, and they're easily agitated. They can't sit still very easily. This manifests in childhood, but it can absolutely survive well into adulthood. So this is not just a childhood disorder, although it typically manifests in childhood. But it can be really frustrating. So having a contextual understanding that they're not being difficult, they're not being defiant, they're literally unable to control their agitation, their energy, their inability to sit still is beyond their control without medication. Medications do treat it fairly successfully, but not everybody is on medication, stays on medication, and not everybody, the medication doesn't work for everybody. So this is just a really quick peek into disorders of the brain and the central nervous system that you are very likely to come across, that you need to have on your radar to understand what it is, what kinds of behaviors you're going to see in order for you to give the right response.